Assalamu alaikum. Thank you very much, Mr. Muhammad, for the introduction. Thank you, Zubayda. Well done presentation. I know this is the end of the day, and I thank the organizing committee for inviting me to present our KFMC experience in the audit department. It will be like a short focused report about the main findings and gaps and the interventions, the effective intervention that has been proved benefit for the program and reduction of VTE cases. So, Bismillah ar-Rahman ar-Rahim. So, as an introduction, we know that VTE is a common complication among hospitalized patients, and they have the potential to cause significant morbidity and mortality, and the prevention is, for many cases, the appropriate prophylaxis is given. So, what's up the program structure? Actually, this program that we are running in KFMC is already aligned with the OMH National VTE Prevention Program. So there is not much difference from that. Also the main feature of this program, it is a multidisciplinary team involvement, like Ms. Zubayda mentioned about the VTE committee and the constituent, the team member that constitute of this committee is diverse, including all the important specialties that is related to the prevention and management of the VTE program. What we are monitoring in this program is 4 main KPIs, which is the hospital-acquired VTE, the screening and assessment of the patient with VTE risk group, reassessment of VTE risk when patient condition changes, and the appropriate use of VTE prophylaxis. And this is similar to the national-wide VTE program. So the methodology has been changed since the change of the electronic health record in our hospital. Initially, we were reviewing the files to get the sample of the patient has been admitted, around 10% of the admission rate. Going case by file to review them. But currently now with the EPIC system, all of these has been automated, and all of this result can be built in the dashboard, and we get the result immediately from the EPIC, currently in our validation state. Sorry. So these are, I think, Dr. Saleh AlGhamdi also, he mentioned about this program in his talk, and I will just show similarly what this is the details of the KPI definition sheet and the definition and the exclusion inclusion criteria for the 3 KPIs, main KPIs related to the rate and the assessment and to the giving the prophylaxis in accordance with the guidelines. So first of all, what I want to share is our experience and our finding related to the quality of the data collected. As also Ms. Zubayda mentioned about the quality of data collection, is very important that we have data and we have reliable data, because decisions has been made based on the data will have like consequences. So that's why what we find mainly 2 types of variation of data collection or errors in the data collection and the data representation. The first group, I can say this is the overestimation of the cases related to the VTE rate. So this problem is caused by excess inclusion of VTE cases that leads to false alarming of poor performance. And at some time in our hospital, we had this problem, but we fixed it, alhamdulillah. And that was related to the validation of the cases, because every month, all the cases that has been submitted, they should undergo validation process. This validation should done by trained individuals, and they should use the criteria, because if you change the data collector and the people who validate, you should train them every time. This is one of the problems that initially we had like a fixed person to do the validation. Later on, when this patient with this person or staff he got retired, then the handover was not done in the right way, and that led to the accumulation of the cases that should be excluded from the list, and that will lead to overestimation of the number of the VTE happen in the hospital. So this is the first group of a problem that we face during data collection. The other group, the other part is what we call underestimation of cases, and this is related to the underreporting of the VTE cases, because the radiology physicians, they are the source of the data. So if the radiologist he didn't flag this case as VTE and put it in the list during the data collection phase, we will miss this case and nobody know about it. So this is very important that every physician's coming to rotating to the radiology department, he should be trained about this, and he should know that this is a critical result, should be recorded according to the guideline and the policy of the hospital. And also this, what will happen if we miss such cases, it will lead to mislead the hospital as excellent performance, because we have less VTE rate, and in fact you are underreporting the VTE rate. So this is the example of the inclusion exclusion criteria that should be used by the data collector and data validator. They should review the case against this criteria and include and exclude based on these detailed lists here. So what efforts has been done to improve the data quality? What we need to do is we need to engage the radiologists because their engagement is very vital, as they are the primary source of data. So if you have a trained radiologist that what they have to do, you will end with more accurate and more reported cases related to the VTE. The second step is automating the generation of data, and this is what is happening now in our hospital by using the electronic health record, the EPIC. And this also needs further validation by manual collection, manual validation and justification of the cases. We will not just take the data as it is from the EPIC. It should be also manually validated and justified for the reasons for any case that we find in the raw data itself. The last thing is the feedback to be given for data collectors to improve and learn from experience. This is very important. So the data collector, they will know what are their mistakes, and they will try not to repeat next time, and to have more accurate data. And with the time, with their experience, they'll be more confident in collecting and submitting their data. So what we did after that, as mentioned, Ms. Zubayda, about the VTE committee role of also analysis of the data that we have. We do the process mapping, we do the root cause analysis, brainstorming with multidisciplinary team, and we came with the recommendations. And what we find that the most effective interventions that is important to be considered in any hospital is, first one, the electronic alert system. We should have an electronic alert system to support completion of the VTE screening, as you mentioned, on admission and reassessment at patient condition change. And this is only effective when it is a hard stop. So this is very important. Not the HR alone is not effective, as you should make this mandatory for people, because most of the physician and trainees, whenever they get admit the patient, if the VTE assessment is not mandatory, because of the there is a lot of work should be done, admitting the patient, orders, HMP, a lot of things. So if this is not a mandatory, they will skip it most of the time. So when you make it a hard step, it will improve the compliance with the assessment. Another thing is the education, and this is what we mean about interactive education and awareness for physicians, especially the trainees. Always do not focus on the EDMA, the medical staff itself. Also, we have to include the trainees, because the trainees, they are the one who is the frontliners. They are in the field. They are the one who is in direct contact with the patient and with these forms or electronic record that they should fill it. So interactive education is like the most effective way of delivering the message that we need from them and improve the compliance. Another thing that we find is the engagement of physiotherapy services for post-surgical, elderly, and bedridden patients as early as possible, because physiotherapy, they will have a role in preventing VTE if they has been engaged. And this is one of the gaps that we found during our analysis. Last thing that I want to mention is about using alternative prophylaxis, such as pneumatic compression devices. And this is indicated when we have like a contraindication to use the pharmacological interventions based on the patient condition. And that's it from my side. Thank you very much for listening. And I'm happy to hear any question either now or at the end of the conference. Thank you very much.